Hello, everybody. Thank you so much for being here. Thank you for all that you're doing to promote breastfeeding. As you all know, as well as I, breastfeeding is a critical part of having healthy infants and healthy children, as well as healthy mothers in Philadelphia. So we are delighted to have you as partners and really excited about all that's happening in partnership between employers and the Health Department, Maternity Care Coalition, and others to promote breastfeeding. The World Health Organization and the American Academy of Pediatrics are both very clear that breast milk should be the only food for infants from birth until age 6 months, and then women should continue to breastfeed if possible through a year of age, and as long after that as they wish to, supplementing from 6 months on with solid foods. Very important, but in order for that to happen, we need an employer community that supports breastfeeding. Not easy to do. We know that some employers have done the hard work to think about what's needed, and we are really appreciative of you all being members of employer groups and agencies that have supported breastfeeding. In 2010, in October, the Surgeon General issued a call to action to support breastfeeding, and in that he urged employers to be part of the solution for promoting breastfeeding for women and to commit to helping women meet their own personal breastfeeding goals. Part of that is not only making a work environment, but also a health insurance environment that supports women's health in general and breastfeeding in particular. Healthy People 2020, the health objectives for the nation, highlight the need for employers to be part of the solution to promoting breastfeeding for women and their children. The Affordable Care Act, the Patient Protection and Affordable Care Act, the ACA as it's called, also requires employers to provide reasonable break time and a private non-bathroom place for employees to express breast milk during the workday for the child's first year of life. So the difficulty that many employers at the moment have in Philadelphia is even conceptualizing how they're going to allow the many women who are working in Philadelphia that private time. You all are providing both inspiration and example for all of the employers in Philadelphia who are going to need to move forward in helping women be able to express and save breast milk during that critical first year of their infant's life. We in Philadelphia have an extensive agenda on breastfeeding. We are both promoting it more generally. We have partnerships that have been wonderful with hospitals in town. If people here, I know some of you are from hospitals, or maybe others who are here from hospitals. We're trying to partner with hospitals, with the Maternity Care Coalition specifically, to inform women and promote and support women during those first critical few hours and days when they're in the hospital with their infant, to help them if they have an interest in breastfeeding and to promote breastfeeding if they haven't had the opportunity to think about it before the delivery of their infant. We want hospitals to not promote artificial milk, but rather to help women breastfeed. That's a major change in thinking for many of the hospitals nationally, but particularly in Philadelphia. We are seeing movement among the hospital community to do that. We salute those hospitals that are willing to take the difficult task of saying no to formula manufacturers and saying we're not going to begin handing a woman formula the minute that her infant is handed to her, but rather we're going to help her breastfeed if possible. If she chooses to formula feed, that's okay, but we're not going to actively promote formula feeding. Rather, we're going to promote breastfeeding. I think it's a critical change for Philadelphia and one that we see as important as part of the partnership. The Maternity Care Coalition and Get Healthy Philly, which is part of the Health Department's program to prevent obesity in Philadelphia, have tried to move forward making environments throughout Philadelphia, including the workplace, more breastfeeding friendly. And today I celebrate as the official coordinator of Get Healthy Philly, the partnership with the Maternity Care Coalition and with all of you. In the workplace, a major barrier to breastfeeding for mothers has been their knowledge that they need to return to work. And for many mothers, they stop breastfeeding at that 6-week, 3-month, 10-week, whatever it is, period, because they simply don't have an idea that their workplace will allow them to do what they need to do. In 2009, the Society for Human Resource Management found that only 25% of companies had lactation programs. In Philadelphia, we don't know the number, but we know that it's not high enough. With the Affordable Care Act putting a responsibility on employers to promote breastfeeding and allow lactation in the workplace, we have felt as the Health Department and the Maternity Care Coalition that we need to work with employers and make resources and information available. So, we know that if we all together support workplace lactation, we will save employers between $3 and $11 for every dollar invested in the program because of not only the health of the infant, so women and other family members needing to take time off from work because of sick infants who won't get sick if they eat breast milk, and 2, because the health of the mother. Breastfeeding is good for women, and breastfeeding is good for infants, so it not only saves in terms of lost time from the workplace, but it also saves in terms of health expenditures for employee health plans. The Maternity Care Coalition has provided technical assistance and support to 12 Philadelphia-based employers to help them enhance their policies and practices to comply with the Affordable Care Act and to establish workplace lactation support programs. And as a result, we estimate that about 18,000 women who are employees of those 12 agencies are now benefiting from the work that was done and will be able to breastfeed in their workplace should they so desire. Today we also celebrate World Breastfeeding Week. And as you see, we have a celebration with lots of people here. It's a wonderful turnout. Part of that is to celebrate those employers who have been exemplary in their promotion of breastfeeding in the workplace. So it is my great and excitement that we will celebrate those employers, but before we do so, I'm going to turn this back over to Raquel Arun, who is going to provide us with a video to help explain what is going on and what this means.